Question 1. Quality control measures reveal that a recent claim assessment for a respiratory condition has been flagged for potential inaccuracies. The claimant's medical report details a diagnosis of acute inflammation affecting the cartilaginous structure responsible for voice production and protecting the lower airways. The assessor, however, has broadly categorized the condition as a throat infection, without specifying the exact anatomical site of the inflammation. Considering the AN79F Foundation Certificate in Insurance GE 20007-15, exams focus on medical terminology in an insurance context. Which of the following approaches to re-evaluating this claim assessment is most appropriate? Option A. Re-evaluate the claim by seeking a general medical opinion on throat infections to confirm the severity of the condition, without delving into the specific anatomical details mentioned in the original report. Option B. Re-evaluate the claim by focusing on the claimant's reported symptoms of discomfort and difficulty speaking, assuming these are sufficient indicators of the condition's impact without further anatomical clarification. Option C. Re-evaluate the claim by precisely identifying the anatomical structure affected by the inflammation, using the specific medical term for that structure, and then assessing the claim's validity and benefit entitlement based on the policy's terms and conditions related to that specific anatomical site and its associated conditions. Option D. Re-evaluate the claim by cross-referencing the broad diagnosis of throat infection with common upper respiratory tract infections, without specifically referencing the cartilaginous structure mentioned in the medical report. Correct answer is C. Re-evaluate the claim by precisely identifying the anatomical structure affected by the inflammation, using the specific medical term for that structure, and then assessing the claim's validity and benefit entitlement based on the policy's terms and conditions related to that specific anatomical site and its associated conditions. Explanation. This scenario presents a professional challenge due to the need to accurately assess a claim involving a respiratory condition, requiring a nuanced understanding of medical terminology within the specific context of insurance. Claims assessment under the AN79F Foundation Certificate in Insurance GE 20007-15 regulatory framework. The challenge lies in correctly interpreting the claimant's medical information and applying it to the policy terms, ensuring fair and compliant claim handling. Careful judgment is required to avoid misinterpreting anatomical terms, which could lead to an incorrect assessment of the condition's severity, duration, or impact on the insured's ability to work, potentially resulting in underpayment or denial of a valid claim or overpayment of an invalid one. The correct approach involves meticulously reviewing the claimant's medical report, identifying specific references to the respiratory tract anatomy, and correlating these with the policy's definitions and exclusions. This approach ensures that the assessment is grounded in factual medical evidence and adheres strictly to the policy's contractual obligations and the regulatory requirements of the AN79F framework. Specifically, understanding terms like nasal polyps affecting the nose, pharyngitis inflammation of the pharynx, laryngitis inflammation of the larynx, tracheitis inflammation of the trachea, bronchitis inflammation of the bronchi, or pneumonia affecting the lungs is crucial for determining the extent of the illness and its implications for the insured. This aligns with the ethical duty of care and the regulatory expectation of diligent and fair claim handling. An incorrect approach that focuses solely on a general diagnosis, without dissecting the anatomical location and nature of the respiratory issue, fails to meet the required standard of care. For instance, if a claim is assessed based on a broad term like breathing difficulty, without investigating whether the issue stems from the upper airways, nose, pharynx, larynx, or lower airways, trachea, bronchi, lungs, it could lead to misclassification of the condition's impact. This demonstrates a failure to apply the necessary medical terminology in an insurance context, potentially breaching the duty to investigate claims thoroughly and fairly. Another incorrect approach might be to rely on outdated or irrelevant medical information, ignoring the specific anatomical details provided in current reports, which would be a failure in due diligence and could lead to an inaccurate assessment, contravening the principles of good insurance practice. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the policy wording and its definitions. Second, meticulously review all submitted medical documentation, paying close attention to the specific anatomical structures of the respiratory tract mentioned and the nature of any pathology. Third, Consult with medical professionals if the terminology or implications are unclear, ensuring that the assessment is based on accurate medical interpretation. Fourth, apply the policy terms to the medically assessed condition, ensuring that the decision is justifiable, transparent, and compliant with all relevant regulations. Question 2. Operational review demonstrates that a significant number of claims involve fractures. To ensure accurate claims assessment and appropriate benefit allocation, it is crucial to correctly identify the type of bone affected by the fracture. Consider a scenario where a policyholder sustains a fracture to the patella. Which classification of bone best describes the patella, and why is this classification important for the initial assessment of the claim? Option A. The patella is a short bone, and its classification is important because short bones are typically found in areas like the wrist and ankle, and fractures to these bones generally have a predictable and shorter recovery period, influencing the duration of income protection benefits. Option B. The patella is a flat bone, and its classification is important because flat bones provide broad surfaces for muscle attachment and organ protection, and fractures to these bones can affect these functions, influencing the assessment of medical expenses and rehabilitation costs. Option C. The patella is a long bone, and its classification is important because long bones are the primary weight-bearing structures, and fractures to these bones often result in prolonged recovery and significant impact on mobility, affecting the assessment of permanent impairment benefits. Option D. The patella is an irregular bone, and its classification is important because irregular bones often have complex shapes that can lead to complications in healing and rehabilitation, impacting the assessment of temporary total disability benefits. Correct answer is D. The patella is an irregular bone, and its classification is important because irregular bones often have complex shapes that can lead to complications in healing and rehabilitation, impacting the assessment of temporary total disability benefits. Explanation. This scenario presents a professional challenge for an insurance claims assessor due to the need to accurately categorize injuries based on anatomical structures, specifically bone types, within the context of the AN79F Foundation Certificate in Insurance GE 20007-15 curriculum. The challenge lies in applying theoretical knowledge of bone classifications to practical, real-world medical scenarios, ensuring that the classification directly impacts the assessment of the claim's severity and potential treatment pathways, all while adhering to the specific regulatory framework of the exam. Careful judgment is required to avoid misclassification, which could lead to underpayment or overpayment of claims, impacting both the insured and the insurer. The correct approach involves a thorough understanding of the anatomical characteristics of long bones, short bones, flat bones, and irregular bones, and their relevance to common insurance claims. For instance, a fracture to the femur, a long bone, typically involves a more complex healing process and potentially greater impact on mobility than a fracture to a carpal bone, a short bone. This accurate classification is crucial for determining appropriate benefit levels, rehabilitation needs, and potential long-term disability assessments, aligning with the principles of fair and accurate claims handling as implicitly guided by the professional standards expected within the insurance industry, and the specific learning outcomes of the GE 20007-15 unit. An incorrect approach would be to focus solely on the mechanism of injury, without considering the specific bone involved. For example, a high-impact trauma might cause a fracture to a flat bone like the scapula, but if the assessor only considers the impact force and not the nature of the bone, they might misjudge the potential for complications or the recovery timeline. This fails to demonstrate the required understanding of how different bone types influence injury outcomes, a key learning objective. Another incorrect approach would be to apply generic medical terminology without linking it to the specific bone classification required by the unit. For instance, describing a bone break without identifying whether it's a long, short, flat, or irregular bone and its implications for the claim misses the core requirement of the question. This demonstrates a superficial understanding and a failure to engage with the specific learning material. The professional decision-making process for similar situations should involve a systematic approach. First, identify the specific anatomical injury reported. Second, consult relevant medical documentation to confirm the exact bone involved. Third, classify the bone according to the established categories: long, short, flat, irregular. Fourth, consider how the characteristics of that bone type might influence the severity, treatment, and recovery prognosis of the injury. Finally, apply this understanding to the insurance claim assessment, ensuring that the classification informs the decision-making process in line with the policy terms and the regulatory framework. Question 3. Comparative studies suggest that the accurate application of anatomical directional terms in medical reports is paramount for effective insurance claims assessment. An insurance assessor reviews a medical report detailing a claimant's knee injury. The report states, the claimant presents with a tear of the medial meniscus, located on the anterior aspect of the left knee. Which of the following interpretations by the assessor best reflects a correct understanding of the injury's location and nature within the context of insurance assessment? Option A. The injury is a superior lesion to the patella, affecting the distal femur. Option B. The injury is a tear of the medial meniscus on the anterior aspect of the left knee. Option C. The injury is a proximal medial collateral ligament sprain of the right tibia. Option D. The injury involves a tear of the lateral meniscus on the posterior aspect of the right knee. The correct answer is D. The injury involves a tear of the lateral meniscus on the posterior aspect of the right knee. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to accurately interpret medical information, specifically directional anatomical terms, to determine the extent of a claimant's injury and its impact on their ability to perform daily activities. Misinterpreting these terms can lead to incorrect assessments of disability, potentially resulting in underpayment or overpayment of claims, and can significantly impact the claimant's financial well-being and access to necessary medical treatment. The assessor must navigate the complexities of medical terminology within the specific regulatory framework of the AN79F Foundation Certificate in Insurance GE 20007-15 exam, ensuring compliance with Australian insurance law and ethical practice. Correct approach analysis. The correct approach involves the assessor accurately identifying the claimant's injury as being located on the anterior aspect of the left knee, specifically a medial meniscus tear. This precise understanding of the anatomical location, using terms like anterior towards the front and medial towards the midline, is crucial for determining the severity and potential functional limitations. For instance, a medial meniscus tear is distinct from a lateral meniscus tear, and its anterior location can influence pain patterns and the biomechanics of the knee. This accurate interpretation directly informs the assessment of the claimant's capacity for work and daily living, aligning with the principles of fair and accurate claims handling as mandated by Australian insurance regulations, which emphasize evidence-based decision-making and adherence to policy terms. Incorrect approach is analysis, an approach that interprets the injury as being on the posterior aspect of the right knee, affecting the lateral meniscus, demonstrates a fundamental failure to correctly apply directional and anatomical terms. Posterior, towards the back, is the opposite of anterior, and lateral, towards the side, is distinct from medial. This misinterpretation would lead to an entirely different diagnosis and assessment of the injury's impact, violating the duty of care and the requirement for accurate factual assessment under Australian insurance law. An approach that describes the injury as being superior to the patella, affecting the distal femur, also exhibits a critical misunderstanding. Superior, above, and distal, further from the point of origin, are relative terms. While the femur is superior to the knee joint, and the distal femur is part of the knee articulation, this description lacks the specificity of the meniscus tear and its precise location within the knee joint. It fails to pinpoint the actual pathology and its functional implications, leading to an incomplete and potentially misleading assessment, which is contrary to the principles of good faith and fair dealing expected of insurance professionals in Australia. An approach that focuses on the proximal aspect of the tibia, describing a medial collateral ligament, MCL sprain, is also incorrect. While the proximal tibia is part of the knee complex and a medial injury is relevant, the description of a ligament sprain is a different pathology than a meniscus tear. Furthermore, proximal, closer to the point of origin, is a different directional reference than the anterior aspect of the knee. This misidentification of the injured structure and its precise location would result in an inaccurate assessment of the claimant's condition and needs, failing to meet the standards of professional diligence and accuracy required by the industry. Professional reasoning. Professionals should adopt a systematic approach when reviewing medical reports. This involves 1. carefully reading the entire report to understand the reported diagnosis and findings. 2. Cross-referencing medical terminology with anatomical charts or dictionaries if unsure of precise meanings, particularly directional terms. 3. Focusing on the specific anatomical structures identified and their precise locations as described. 4. Considering how the identified injury and its location would realistically impact the claimant's functional capacity. 5. Ensuring the assessment aligns with the policy wording and relevant Australian insurance legislation, such as the Insurance Contracts Act 1984, CTH, and relevant Australian Prudential Regulation Authority, APRA, guidelines, which mandate fair treatment of policyholders and accurate claims assessment. When in doubt, seeking clarification from the medical professional or a senior colleague is a crucial step in maintaining professional integrity and ensuring accurate claims outcomes. Question 4. The evaluation methodology shows that an insurance assessor is reviewing a claim where the claimant's medical report mentions trabecular thinning and reduced medullary cavity volume. Which of the following approaches best aligns with the AN79F Foundation Certificate in Insurance, G 20007-15 exam? Requirements for assessing the functional impact of such findings on the insured's ability to perform their occupation. Option A. Interpret trabecular thinning and reduced medullary cavity volume as purely descriptive terms with no direct bearing on the insured's functional capacity, unless explicitly stated as causing a specific disability. Option B. Focus solely on whether the claimant has reported any immediate pain or inability to perform their job due to the mentioned terms, disregarding the underlying structural implications. Option C. Assess the claim based on the presence of trabecular thinning and reduced medullary cavity volume as indicators of compromised spongy bone integrity and potential bone marrow space reduction, and evaluate how this might affect the insured's physical capacity and risk of fracture in relation to their occupational duties. Option D. Attempt to diagnose the specific bone disease causing these changes and base the assessment on that self-diagnosed condition. The correct answer is C. Assess the claim based on the presence of trabecular thinning and reduced medullary cavity volume as indicators of compromised spongy bone integrity and potential bone marrow space reduction, and evaluate how this might affect the insured's physical capacity and risk of fracture in relation to their occupational duties. Explanation. Scenario analysis. This scenario presents a professional challenge for an insurance assessor by requiring them to apply medical terminology related to bone structure and function within the specific regulatory framework of the AN79F Foundation Certificate in Insurance, G 20007-15 exam. The challenge lies in accurately interpreting a claimant's medical report, which may use terms like osteopenia or osteoporosis, indicating reduced bone density, often associated with spongy bone loss, and relating this to the functional capacity of the insured, particularly concerning their ability to perform activities of daily living or their occupation. Misinterpreting these terms could lead to an incorrect assessment of the claim's validity or the appropriate benefit payable, potentially breaching the insurer's duty of care and good faith. Correct approach analysis. The correct approach involves a thorough understanding of the claimant's medical report, specifically identifying any references to bone density, structural integrity, or bone marrow function. This understanding must then be translated into the context of the insurance policy's terms and conditions, considering how conditions affecting compact bone, providing strength and rigidity, spongy bone, providing shock absorption and housing bone marrow, or bone marrow, producing blood cells and storing fat, might impact the insured's functional capacity and therefore their claim. The assessor must then apply the AN79F GE 20007-15 exams principles, which likely emphasize accurate assessment based on medical evidence and policy wording, ensuring that the assessment is fair, objective, and consistent with industry standards for medical terminology in insurance. This approach ensures that the assessment is grounded in both medical reality and the contractual obligations of the insurance policy. Adhering to the regulatory framework. Incorrect approach is analysis. An approach that focuses solely on the presence of terms like fracture without considering the underlying bone structure or function is incorrect. This fails to delve into the why behind the fracture, such as weakened spongy bone due to osteoporosis, which is crucial for assessing the long-term implications and potential for recurrence. This superficial analysis ignores the functional impact of compromised bone integrity, An approach that dismisses any medical terminology not directly related to immediate, acute pain or visible injury is also incorrect. This overlooks conditions that may have a progressive impact on bone structure and function, such as changes in bone marrow affecting blood cell production or systemic conditions impacting bone density. The AN79F framework requires a comprehensive understanding of medical information relevant to the claim, an approach that attempts to diagnose the claimant's condition based on the medical report, rather than interpreting the provided medical information within the insurance context, is professionally inappropriate and potentially outside the assessor's scope of practice. The assessor's role is to understand and apply medical information to the insurance claim, not to act as a medical practitioner. This overreach can lead to misinterpretations and incorrect assessments. Professional reasoning. Professionals should adopt a systematic approach. First, carefully read and understand the claimant's medical report, paying close attention to all medical terminology, especially that relating to bone structure and function. Second, cross-reference this information with the specific terms and conditions of the insurance policy, identifying how the reported medical condition might affect the insured's ability to perform their occupation or daily activities as defined by the policy. Third, consult relevant AN79F GE 20007-15 exam materials or internal guidelines to ensure accurate interpretation and application of medical terms within the insurance context. Finally, document the assessment clearly, justifying the conclusions based on the medical evidence and policy provisions. Question 5. Investigation of a claimant presenting with severe nausea and vomiting, leading to significant weight loss and dehydration, requires an insurer to differentiate between disruptions in the initial stages of the digestive process, which comparative analytical approach best aligns with the principles of accurate medical terminology application within an insurance context. As per the AN79F Foundation Certificate in Insurance GE 20007-15 exams regulatory framework, when assessing the potential impact on a policy. Option A, focusing solely on the symptoms of dehydration and electrolyte imbalance as the primary claim drivers. Option B, analyzing the impact of bowel obstruction on the elimination phase without considering upstream digestive failures. Option C, examining the correlation between gastrointestinal symptoms and dermatological conditions. Option D, comparing the implications of impaired ingestion, e.g., dysphagia, versus impaired digestion, e.g., enzyme deficiencies, on nutrient intake and overall health. The correct answer is D, comparing the implications of impaired ingestion, e.g., dysphagia, versus impaired digestion, e.g., enzyme deficiencies, on nutrient intake and overall health. Explanation: scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to apply complex medical concepts related to digestive processes to an insurance claim, while strictly adhering to the AN79F Foundation Certificate in Insurance GE 20007-15 exams regulatory framework. The challenge lies in accurately interpreting the claimant's medical information, understanding how disruptions in ingestion, digestion, absorption, or elimination might manifest as insurable events, and then assessing the claim's validity and quantum within the confines of the policy and relevant Australian insurance law and guidelines. Misinterpreting medical terminology or the physiological processes involved could lead to incorrect claim assessments, potentially resulting in underpayment or overpayment and breaches of regulatory obligations. Correct approach analysis. The correct approach involves a comparative analysis of how disruptions in different stages of the digestive process, ingestion, digestion, absorption, elimination, could lead to distinct types of medical conditions and, consequently, different insurance claim implications. This approach is correct because it systematically examines the potential impact of pathology at each stage of the digestive tract's function. For instance, a failure in ingestion might relate to dysphagia impacting nutritional intake, while a malabsorption syndrome, failure in absorption, would have different diagnostic and treatment pathways and thus different claim considerations. This structured analysis ensures that all relevant aspects of the digestive process are considered in relation to the claimant's condition and the policy's coverage, aligning with the professional duty of care and the need for thorough, evidence-based claim assessment under Australian insurance regulations. Incorrect approaches analysis. An approach that focuses solely on the symptoms of gastrointestinal distress without differentiating the underlying digestive process affected is incorrect. This fails to provide the necessary depth of analysis required for accurate claim assessment. For example, attributing all abdominal pain to a single cause without investigating whether it stems from impaired ingestion, faulty digestion, or absorption issues overlooks crucial diagnostic information and can lead to misclassification of the condition and inappropriate claim handling. This approach risks violating the principle of fair and equitable treatment of policyholders by not adequately investigating the root cause of the claim. An approach that prioritizes the final stage of elimination without considering the preceding digestive processes is also incorrect. While elimination disorders are significant, they are often a consequence of issues earlier in the digestive pathway. Focusing exclusively on elimination might miss the primary pathology, leading to an incomplete assessment of the claimant's condition and its impact. This could result in a failure to identify the full extent of the insured event, potentially leading to underinsurance or incorrect benefit calculations, which contravenes the insurer's obligation to assess claims fairly and accurately. An approach that attempts to link digestive processes to unrelated bodily systems without a clear medical or pathological connection is fundamentally flawed and incorrect. This demonstrates a lack of understanding of both medical science and insurance principles. Such an approach would lead to irrelevant investigations, misdiagnosis, and ultimately, an unfounded claim assessment. This is a direct breach of professional conduct and regulatory requirements for competent claim handling. Professional reasoning. Professionals should adopt a systematic, evidence-based approach. This involves 1. Thoroughly understanding the claimant's medical report, paying close attention to diagnostic terms and their implications for digestive function. 2. Applying knowledge of the digestive process, ingestion, digestion, absorption, elimination, to categorize the claimant's condition based on the affected stage. 3. Researching the specific medical conditions associated with disruptions at each stage and their typical insurance implications. 4. Comparing the claimant's presentation and diagnosis with policy terms and conditions, and relevant Australian insurance law and guidelines. 5. Consulting with medical professionals if necessary to clarify complex medical information. This structured process ensures that all relevant factors are considered, leading to a fair, accurate, and compliant claim outcome. Question 6. The control framework reveals that a claimant has submitted a medical imaging report detailing a suspected fracture. The report states the fracture line is clearly visible extending across the frontal plane of the affected limb. In assessing the claim, which interpretation of the anatomical plane description is most crucial for accurately determining the extent and potential impact of the injury? Option A. Assuming the frontal plane description is a minor detail and focusing only on the fact that a fracture is present. Option B. Concluding that the frontal plane is irrelevant to fracture assessment as it only describes superficial anatomy. Option C. Recognizing that the frontal plane is the most common plane for fractures, implying a standard severity. Option D. Understanding that the frontal plane divides the body into anterior and posterior sections, and therefore the fracture's impact is on the front and back of the limb. Correct answer is D. Understanding that the frontal plane divides the body into anterior and posterior sections, and therefore the fracture's impact is on the front and back of the limb. Explanation. This scenario presents a professional challenge for an insurance claims assessor due to the need to accurately interpret medical imaging reports, which are crucial for determining the extent of a claimant's injury and the validity of their claim. Misinterpreting anatomical planes can lead to incorrect assessments of injury severity, potentially resulting in underpayment or overpayment of claims, and impacting the insurer's financial stability and reputation. Adherence to the ANZIF Foundation Certificate in Insurance, G 20007-15, regulatory framework, which emphasizes accurate claims handling and professional conduct, is paramount. The correct approach involves a thorough understanding of anatomical planes as described in medical imaging reports, specifically relating them to the claimant's reported injury. This means correctly identifying whether a lesion, fracture, or other pathology is described in relation to the sagittal, frontal, or transverse plane. For instance, a report detailing a fracture extending through the frontal plane would indicate a break that divides the body into anterior and posterior sections, which is distinct from a fracture along the sagittal plane, dividing into left and right, or transverse plane, dividing into superior and inferior. This precise understanding ensures that the assessor can accurately gauge the anatomical location and potential functional impact of the injury, aligning with the principles of fair and accurate claims assessment mandated by insurance regulations. An incorrect approach would be to assume that all injuries described in relation to a specific anatomical plane have a uniform impact, regardless of the actual imaging findings. For example, assuming any injury described in the sagittal plane is minor without considering the specific details of the report would be a failure. This overlooks the critical need for detailed analysis of the medical evidence, leading to potential misclassification of injury severity. Another incorrect approach would be to disregard the specific anatomical plane mentioned in the report and focus solely on the general type of injury. This demonstrates a lack of diligence in reviewing the provided medical documentation and a failure to apply the specific diagnostic information contained within it, thereby contravening the duty of care owed to both the claimant and the insurer. A further incorrect approach would be to rely on anecdotal knowledge or general assumptions about injuries rather than the specific radiological findings presented in the report, which is a direct contravention of the requirement for evidence-based claims assessment. Professionals should employ a systematic decision-making process that begins with a comprehensive review of all submitted documentation, including medical imaging reports. They must then cross-reference the findings described in these reports with the claimant's stated injury and the terms of the insurance policy. When dealing with anatomical descriptions, it is essential to have a working knowledge of medical terminology, including anatomical planes, and to seek clarification from medical professionals if any aspect of the report is unclear. This ensures that the assessment is grounded in factual evidence and adheres to regulatory requirements for fair and accurate claims handling. Question 7. The efficiency study reveals that claims involving joint injuries are experiencing delays due to inconsistent assessment methodologies. An insurance assessor is reviewing a claim for a client who has sustained a significant injury to their knee. The medical report indicates a tear in the articular cartilage and damage to the ligaments, impacting the knee's ability to perform flexion and extension. Considering the AN79F6 Foundation Certificate in Insurance, G20007-15 exam, requirements for using medical terminology in an insurance context and focusing on joint types and movements, which of the following approaches would be most appropriate for assessing the functional impairment related to this knee injury? Option A. Broadly describe the knee as a weight-bearing joint and assess the impact solely on the insured's ability to stand for prolonged periods. Option B. Determine the most cost-effective surgical intervention for cartilage repair and base the claim assessment primarily on the projected treatment expenses. Option C. Classify the knee injury as a general joint mobility issue and focus the assessment on the insured's reported pain levels during everyday activities. Option D. Accurately identify the knee as a synovial joint, detailing how the damage to the articular cartilage and ligaments specifically restricts its characteristic movements of flexion and extension, and assess the resulting functional loss based on this biomechanical understanding. The correct answer is D. Accurately identify the knee as a synovial joint, detailing how the damage to the articular cartilage and ligaments specifically restricts its characteristic movements of flexion and extension, and assess the resulting functional loss based on this biomechanical understanding. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the insurance assessor to apply their understanding of anatomical joint types and their associated movements within the specific regulatory framework of the AN79F Foundation Certificate in Insurance, G20007-15 exam. Misinterpreting the biomechanical limitations of a particular joint type, such as a synovial joint's potential for extensive movement versus a fibrous joint's limited mobility, could lead to an inaccurate assessment of the insured's functional capacity and, consequently, an incorrect claim outcome. This demands a precise application of medical terminology in an insurance context, adhering strictly to the exam's specified guidelines. Correct approach analysis. The correct approach involves accurately identifying the type of joint affected by the insured's condition and correlating this with the documented limitations in movement. For instance, if the insured suffers from a condition affecting a synovial joint, the assessor must consider the inherent range of motion of such joints, e.g., flexion, extension, abduction, adduction, rotation, and assess how the pathology has restricted these specific movements. This aligns with the exam's requirement to use medical terminology in an insurance context and demonstrates a thorough understanding of the biomechanical implications relevant to assessing loss of function. The regulatory framework for this exam emphasizes accurate application of knowledge to practical insurance scenarios, ensuring claims are assessed fairly and consistently based on established medical and insurance principles. Incorrect approaches analysis, an approach that focuses solely on the insured's subjective report of pain, without considering the objective biomechanical limitations of the affected joint type, is incorrect. This fails to apply the necessary medical terminology and understanding of joint mechanics, potentially overlooking the underlying pathology and its impact on functional capacity. It also deviates from the exam's emphasis on a structured, evidence-based assessment, an approach that broadly categorizes all joint issues as mobility problems, without differentiating between the types of joints, synovial, cartilaginous, fibrous, and their inherent movement capabilities, is also incorrect. This lacks the specificity required by the exam and the insurance context, as different joint types have vastly different ranges and types of movement. For example, a fibrous joint like those in the skull has very limited movement compared to a synovial joint in the knee, and an assessment must reflect this distinction. An approach that prioritizes the cost of treatment over the assessment of functional impairment is incorrect. While cost is a factor in insurance, the primary focus for assessing a claim related to a joint injury or condition is the impact on the insured's ability to perform activities due to the impairment of the joint's structure and function. This approach neglects the core requirement of the exam to link medical terminology and anatomical understanding to insurance claims assessment. Professional reasoning. Professionals should adopt a systematic approach that begins with understanding the specific anatomical structure involved, the joint type, its normal biomechanical function, and the documented pathology. This understanding should then be translated into the context of the insurance policy and the insured's reported limitations. The ANSIF GE 20007-15 exam mandates the precise use of medical terminology and a clear link between medical conditions and their impact on insured risks. Therefore, a professional decision-making process would involve 1. Identifying the specific joint and its classification, synovial, cartilaginous, fibrous. 2. Researching the typical movements and limitations associated with that joint type. 3. Correlating the insured's reported symptoms and medical findings with the expected functional impact on that specific joint type. 4. Documenting the assessment using appropriate medical and insurance terminology, ensuring compliance with the exam's regulatory framework. Question 8. The review process indicates that a claimant has submitted a claim for a recent injury, with medical documentation describing a hairline fracture of the distal radius. In the context of the ANSIF Foundation Certificate in Insurance, G 20007-15 exam, and Australian regulatory requirements, which of the following approaches best demonstrates a compliant and professional assessment of this claim? Option A. Accurately identify the medical condition as a fracture of the distal radius. Cross-reference this with the policy's definitions and exclusions for skeletal disorders, and apply the relevant Australian insurance law principles to determine coverage and benefits. Option B. Interpret the term hairline fracture as a minor injury and proceed with a standard payout without verifying the specific policy coverage for fractures. Option C. Assess the claim based on the claimant's reported pain levels and the general understanding that a fracture is a serious injury requiring compensation. Option D. Advise the claimant that a hairline fracture is not a significant enough injury to warrant an insurance claim and suggest they seek further medical advice independently. The correct answer is C. Assess the claim based on the claimant's reported pain levels and the general understanding that a fracture is a serious injury requiring compensation. Explanation. Scenario analysis. This scenario presents a professional challenge for an insurance claims assessor by requiring the application of medical terminology within the specific regulatory framework of the ANSIF Foundation Certificate in Insurance, G 20007-15 exam. The difficulty lies in accurately interpreting a claimant's medical condition, specifically a fracture, and its implications for policy coverage, while adhering strictly to Australian insurance law and the principles of good claims management as outlined in the GE 20007-15 syllabus. Misinterpreting medical terms or misapplying regulatory guidelines can lead to incorrect claim assessments, potentially resulting in financial loss for the insurer or unfair treatment of the claimant. Correct approach analysis. The correct approach involves accurately identifying the claimant's condition as a fracture, a common skeletal disorder, and understanding its implications for the insurance policy. This requires the assessor to correctly interpret the medical terminology used in the claim documentation, such as comminuted fracture or displaced fracture, and relate it to the policy's definitions and exclusions. The assessor must then apply the relevant provisions of Australian insurance law, as covered in GE 20007-15, to determine if the fracture is a covered event and what benefits are payable. This approach is correct because it prioritizes accurate medical interpretation and strict adherence to the specified regulatory framework, ensuring a fair and compliant claim outcome. Incorrect approach is analysis, an approach that focuses solely on the claimant's subjective experience of pain without correlating it to a diagnosed fracture, and the policy terms fails to meet regulatory requirements. This is because insurance policies are based on objective medical evidence and contractual terms, not solely on subjective symptoms. Such an approach risks overlooking policy limitations or misinterpreting the severity of the condition in relation to the insured event. An approach that attempts to diagnose the fracture based on the claimant's description without referring to the medical report or diagnostic imaging is a significant regulatory and ethical failure. The GE 20007-15 syllabus emphasizes the importance of evidence-based assessment. Insurance assessors are not medical practitioners and should not attempt to diagnose. Relying on unqualified interpretation of symptoms rather than professional medical findings violates the principle of due diligence and can lead to incorrect claim assessments. An approach that applies general insurance principles without considering the specific definitions and exclusions related to skeletal disorders within the claimant's policy, as guided by Australian insurance law, is also incorrect. The GE 20007-15 exam requires a nuanced understanding of how policy wordings interact with specific claim circumstances. Ignoring policy specifics in favor of broad generalities can lead to misinterpretations of coverage and noncompliance with the contract of insurance. Professional reasoning. Professionals should adopt a systematic approach. 1. Thoroughly review all submitted documentation, paying close attention to medical reports and diagnostic findings. 2. Accurately interpret medical terminology related to skeletal disorders, such as fractures, arthritis, and osteoporosis in the context of the claim. 3. Cross-reference the diagnosed condition and its cause with the specific terms, conditions, definitions, and exclusions of the relevant insurance policy. 4. Apply the principles of Australian insurance law and the guidelines taught in GE 20007-15 to determine coverage and benefit entitlements. 5. Maintain clear and professional communication with the claimant and any involved medical professionals, ensuring all decisions are well documented and justifiable. Question 9. The performance metrics show a significant increase in claims related to vascular conditions. A claimant presents with a diagnosis of thrombophlebitis affecting a superficial vein in their leg. The policy document contains a clause stating that conditions affecting major arteries are covered, but it is silent on conditions of veins. Which approach best aligns with the regulatory framework and ethical obligations for assessing this claim? Option A. Investigate further by obtaining a detailed medical report clarifying the extent of the thrombophlebitis, its impact on the claimant's mobility and daily activities, and whether it has led to any complications, before assessing coverage against the policy's general provisions and the duty of good faith. Option B. Request the claimant to undergo further medical tests to confirm if the condition could have originated from an arterial issue, even though the initial diagnosis is venous. Option C. Decline the claim outright as the policy specifically mentions arteries and not veins. Option D. Approve the claim immediately, assuming that any vascular condition is covered under a broad interpretation of vascular conditions. The correct answer is C. Decline the claim outright as the policy specifically mentions arteries and not veins. Explanation. This scenario presents a professional challenge due to the inherent complexity of medical terminology within an insurance claims context, specifically concerning blood vessels. The GE 20007-15 exam for the AN79F Foundation Certificate in Insurance requires a nuanced understanding of how medical condition, described using precise anatomical and physiological terms, translate into insurance policy coverage and assessment. The challenge lies in accurately interpreting terms like arteriosclerosis or thrombosis and their implications for claims, ensuring that policy terms and conditions are applied consistently and fairly, without misinterpreting the underlying pathology. This requires not just a basic understanding of medical terms, but also their relevance to the insurance product and the specific circumstances of the claim. The correct approach involves a thorough review of the claimant's medical documentation, focusing on the specific diagnosis related to blood vessels. This includes identifying whether the condition affects arteries, veins, or capillaries, and understanding the severity and prognosis as described by medical professionals. The insurer must then cross-reference this information with the relevant policy wording, paying close attention to definitions, exclusions, and benefit triggers. For example, a policy might cover conditions affecting major arteries but exclude minor capillary damage, unless it leads to a specified complication. Adherence to the Insurance Contracts Act 1984, CTH, in Australia, which governs the duty of disclosure and good faith, is paramount. This approach ensures that the claim is assessed based on factual medical evidence and the contractual obligations of the policy, upholding the principle of good faith by treating the claimant fairly and transparently. An incorrect approach would be to make a broad assumption about the severity of a condition based solely on the presence of a medical term, without understanding its specific manifestation. For instance, assuming any condition involving arteries is automatically a major, disabling event without reviewing the specific diagnosis, e.g., mild peripheral artery disease versus a ruptured aortic aneurysm, would be a failure. This could lead to an incorrect denial or underpayment of a claim, breaching the duty of good faith. Another incorrect approach is to rely on anecdotal information or general medical knowledge rather than the specific medical reports provided for the claim. This bypasses the evidence required for a fair assessment and could lead to decisions that are not supported by the facts, potentially violating the Insurance Contracts Act 1984, CTH, by not acting with utmost good faith. Furthermore, misinterpreting the anatomical location or type of blood vessel involved, e.g., confusing an arterial occlusion with a venous thrombosis in terms of potential impact and coverage, demonstrates a lack of understanding of the medical context, leading to an inaccurate application of policy terms. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the medical terminology and its implications for the claimant's health status. Second, meticulously examine the insurance policy wording to identify relevant clauses, definitions, and exclusions pertaining to the diagnosed condition. Third, apply the policy terms to the medical facts, ensuring consistency and fairness. Finally, communicate the decision clearly and transparently to the claimant, explaining the rationale based on the medical evidence and policy provisions, thereby fulfilling the duty of good faith. Question 10. Assessment of a medical report for an insurance claim indicates a patient sustained a compound fracture of the tibia. The report also notes significant fragmentation of the bone. Which of the following interpretations best aligns with the regulatory framework and medical context for insurance claims assessment in Australia? Option A. The assessor should interpret compound fracture as a minor complication and assess benefits based on a simple fracture, as the primary issue is the bone break itself. Option B. The assessor should disregard the specific fracture type, treating all fractures equally, and apply a generic benefit amount as the medical terminology is overly complex for standard claims processing. Option C. The assessor should classify this as a compound fracture, recognizing the breach of the skin and associated infection risk, and proceed with assessing benefits based on the policy's provisions for open fractures, considering the fragmentation as a secondary detail influencing treatment complexity. Option D. The assessor should focus on the fragmentation of the bone, classifying it as a comminuted fracture, and assess benefits based on standard fracture coverage, as the term compound is less critical for benefit determination. The correct answer is C. The assessor should classify this as a compound fracture, recognizing the breach of the skin and associated infection risk, and proceed with assessing benefits based on the policy's provisions for open fractures, considering the fragmentation as a secondary detail influencing treatment complexity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the insurance assessor to accurately interpret medical terminology within the context of a specific fracture type to determine the appropriate claims handling process. Misinterpreting terms like comminuted or compound can lead to incorrect policy application, potentially resulting in underpayment or overpayment of benefits, and impacting the insurer's financial standing and the claimant's trust. The assessor must balance the need for efficient claims processing with the ethical obligation to fairly assess the claim based on the documented medical evidence and the policy's terms and conditions, all while adhering to the regulatory framework governing insurance practices in Australia. Correct approach analysis. The correct approach involves the assessor accurately identifying the fracture type as a compound fracture based on the medical report. A compound fracture, also known as an open fracture, signifies that the broken bone has pierced the skin, creating a significant risk of infection and often requiring more complex surgical intervention and a longer recovery period. In an insurance context, this classification is critical for determining the level of medical necessity, rehabilitation requirements, and potential for long-term disability benefits as outlined in the policy. Adherence to the Insurance Contracts Act 1984, CTH, and relevant Australian Prudential Regulation Authority, APRA guidelines mandates that claims are assessed based on the factual circumstances and the policy's provisions, ensuring fair treatment of the insured. This approach prioritizes accurate medical interpretation for correct policy application. Incorrect approach is analysis, an approach that focuses solely on the term fracture without differentiating the type, such as a simple or closed fracture, fails to acknowledge the severity and implications of a compound fracture. This oversight can lead to an underestimation of the claim's complexity and associated costs, potentially breaching the duty of utmost good faith owed to the insured under the Insurance Contracts Act 1984, CTH, by not providing the full benefits to which they may be entitled. An approach that misinterprets comminuted as the primary classification, when the report clearly indicates a compound fracture, demonstrates a lack of understanding of the specific medical terminology and its insurance implications. Comminuted fracture refers to the bone breaking into multiple fragments, which can occur with or without the skin being breached. Focusing on comminution without acknowledging the compound nature overlooks the critical factor of external exposure and infection risk, leading to an inaccurate assessment of the claim's overall impact and required benefits. This can result in a failure to meet regulatory expectations for thorough claims investigation. An approach that dismisses the medical terminology as irrelevant and proceeds with a generic assessment based on a standard fracture benefit ignores the detailed information provided by medical professionals. This is a direct contravention of the principles of fair claims handling and the requirement to assess claims based on the specific circumstances and evidence presented. It fails to consider the nuances of different fracture types and their associated medical and financial implications, potentially leading to a breach of the insurer's obligations under Australian consumer law and insurance regulations. Professional reasoning. Professionals should adopt a systematic approach to claims assessment. This involves 1. Thoroughly reviewing all submitted documentation, paying close attention to medical reports and diagnostic findings. 2. Accurately interpreting medical terminology, understanding its implications for treatment, recovery, and potential long-term effects. 3. Cross-referencing the interpreted medical information with the specific terms, conditions, and exclusions of the relevant insurance policy. 4. Applying relevant Australian legislation, such as the Insurance Contracts Act 1984, CTH, and APRA guidelines to ensure fair and compliant claims handling. 5. Documenting the assessment process clearly, justifying the decisions made based on the evidence and regulatory requirements. This structured process ensures that claims are assessed objectively, ethically, and in accordance with the law. Question 11. Upon reviewing a medical report detailing a claimant's injury, which medical term, when considered in the context of the appendicular skeleton and its functional impact on an insured's ability to perform occupational duties, will most directly inform the assessment of a claim under the AN79F Foundation Certificate in Insurance GE 20007-15 exam syllabus? Option A. A note mentioning a minor laceration on the forearm. Option B. A diagnosis of comminuted fracture of the distal tibia and fibula, leading to significant gait disturbance and requiring prolonged physiotherapy. Option C. A report indicating a mild contusion to the lumbar spine. Option D. A statement of general fatigue and malaise. The correct answer is B. A diagnosis of comminuted fracture of the distal tibia and fibula, leading to significant gait disturbance and requiring prolonged physiotherapy. Explanation: this scenario is professionally challenging because it requires the insurance professional to accurately interpret medical terminology within the context of the Australian regulatory framework governing insurance claims, specifically the ANZIA Foundation Certificate in Insurance GE 20007-15 exam syllabus. The challenge lies in applying the principles of assessing claims related to the appendicular skeleton, which encompasses the limbs and girdles, while adhering to the strict requirements of the specified examination. Misinterpreting medical terms, failing to align the assessment with the examination scope, could lead to an incorrect claim outcome, impacting both the insurer and the insured. The correct approach involves a thorough understanding of the appendicular skeleton's anatomical components and their common injuries or conditions, as they might present in an insurance claim. This approach necessitates correlating medical terminology with the potential impact on an individual's ability to perform daily activities or work, which is a core consideration in many insurance policies. Specifically, it requires identifying how conditions affecting the clavicle, scapula, humerus, radius, ulna, carpals, metacarpals, phalanges, pelvis, femur, tibia, fibula, tarsals, metatarsals, and phalanges would be assessed under the GE 20007-15 syllabus, focusing on the functional impairment rather than purely diagnostic terms. This aligns with the examination's objective of assessing practical application of insurance principles in a medical context. An incorrect approach would be to focus solely on the diagnostic label, without considering the functional implications for the insured. For instance, simply identifying a fracture of the distal femur does not, in itself, determine the claim's validity or payout without understanding how that fracture impacts mobility and recovery, which is crucial for assessing the extent of loss. Another incorrect approach would be to use generic medical terms that are not specific to the appendicular skeleton or its associated injuries, thereby failing to demonstrate the required depth of knowledge for the GE 20007-15 exam. Furthermore, an approach that deviates from the scope of the appendicular skeleton, perhaps by focusing on the axial skeleton or internal organs, would be fundamentally flawed as it does not address the specific topic mandated by the question. The professional decision-making process for similar situations should involve a systematic review of the claim details, cross-referencing medical reports with the specific requirements and learning outcomes of the relevant insurance qualification. This includes actively seeking to understand the functional impact of any diagnosed condition, particularly those affecting the appendicular skeleton, and ensuring that the assessment is grounded in the regulatory framework and examination syllabus. When faced with unfamiliar medical terminology, professionals should consult reliable medical dictionaries or resources, always with the aim of translating that terminology into its practical implications for the insured and the insurance policy. Question 12. The risk matrix shows a moderate likelihood of claims related to common muscular disorders such as strains and sprains, and a low likelihood of claims for more complex conditions like muscular dystrophy. A policyholder reports experiencing severe myalgia and a suspected ankle sprain following a fall at home. The policy covers accidental bodily injury, but has specific exclusions for degenerative conditions. Which of the following approaches best aligns with the principles of the ANZIA Foundation Certificate in Insurance, G 20007-15, for assessing this claim? Option A. Process the claim for a strain without verifying the medical cause of the myalgia, assuming it is directly related to the fall. Option B. Review the policy wording for definitions of accidental bodily injury and exclusions. Interpret the reported symptoms of myalgia and sprain in the context of the incident, and determine if the claim falls within the scope of coverage. Option C. Immediately deny the claim as the policyholder mentioned a fall, which could be indicative of underlying degenerative issues not covered by the policy. Option D. Advise the policyholder that muscular dystrophy is a serious condition and they should seek immediate specialist medical attention without first assessing the reported strain. The correct answer is B. Review the policy wording for definitions of accidental bodily injury and exclusions, interpret the reported symptoms of myalgia and sprain in the context of the incident, and determine if the claim falls within the scope of coverage. Explanation. Scenario analysis. This scenario presents a professional challenge for an insurance claims assessor dealing with a policyholder experiencing symptoms indicative of common muscular disorders. The challenge lies in accurately assessing the claim within the framework of the AN79F Foundation Certificate in Insurance, G 20007-15 curriculum, which requires understanding medical terminology in an insurance context. The assessor must navigate the potential for misdiagnosis, the nuances of policy coverage for different types of muscular conditions, and the ethical obligation to process claims fairly and efficiently, all while adhering to the specified regulatory and educational guidelines. The need for precise application of medical terms like myalgia, muscle pain, and tendinopathy, tendon disorder, within the insurance assessment process is paramount. Correct approach analysis. The correct approach involves a thorough review of the policy wording, specifically clauses pertaining to accidental bodily injury and illness. It requires the assessor to interpret the policyholder's reported symptoms, such as acute myalgia and potential sprains, against the definitions and exclusions within the policy. The assessor must then determine if the reported condition, for example, a strain resulting from a specific incident, is covered. This approach is correct because it directly applies the principles taught in GE 20007-15, focusing on the practical application of insurance concepts to medical scenarios. It prioritizes accurate policy interpretation and the correct use of insurance terminology in relation to medical conditions, ensuring that the claim is assessed based on contractual obligations and the specific circumstances of the incident, rather than making assumptions or offering premature advice. Incorrect approach is analysis, an approach that focuses solely on the policyholder's self-diagnosis of muscular dystrophy without further investigation or consideration of the policy's definition of illness or injury is incorrect. This fails to acknowledge that muscular dystrophy is a progressive genetic condition, distinct from acute strains or sprains, and may have specific policy exclusions or waiting periods. It also demonstrates a lack of understanding of the need for professional medical diagnosis in insurance claims, an approach that immediately denies the claim based on the presence of muscular in the description, without a detailed assessment of the reported incident and the specific nature of the muscular disorder, is also incorrect. This is an oversimplification that ignores the possibility of covered events like accidental strains or sprains, which are common muscular disorders. It fails to apply the principles of indemnity and fair claims handling, an approach that suggests the policyholder seek a second medical opinion without first reviewing the existing medical information, and the policy's requirements for supporting documentation is procedurally flawed. While a second opinion might be necessary, the assessor's primary responsibility is to gather and assess the information available in accordance with the policy and the GE 20007-15 curriculum's emphasis on evidence-based claims assessment. Professional reasoning. Professionals should adopt a systematic approach. First, understand the policyholder's reported incident and symptoms, using appropriate medical terminology, e.g., myalgia, sprain, strain. Second, cross-reference these with the specific terms and conditions of the insurance policy, paying close attention to definitions of injury, illness, and any exclusions related to pre-existing conditions or specific types of disorders. Third, identify any gaps in information and request necessary supporting documentation, such as medical reports, ensuring they are relevant to the reported incident and the policy coverage. Finally, make a decision based on the policy terms, the evidence, and the principles of insurance, communicating the outcome clearly and professionally to the policyholder. Question 13. Performance analysis shows that an applicant for a life insurance policy has submitted a medical report containing an electrocardiogram, X/X, showing evidence of possible left ventricular hypertrophy. The underwriting team needs to assess the cardiovascular risk associated with this finding. Which of the following approaches best aligns with the regulatory framework and ethical obligations for insurance professionals in Australia? Option A. Make a preliminary assessment based on the applicant's age and general lifestyle factors, deferring a definitive decision until further, less technical medical information can be obtained. Option B. Base the underwriting decision on the applicant's self-reported symptoms and general health, disregarding the specific ECG findings due to their technical nature. Option C. Interpret the ECG findings using readily available online medical encyclopedias and basic cardiology textbooks to determine the severity of the potential cardiac condition. Option D. Consult with a cardiologist or a physician with demonstrated expertise in ECG interpretation to obtain a professional assessment of the findings and their implications for insurability. The correct answer is C. Interpret the ECG findings using readily available online medical encyclopedias and basic cardiology textbooks to determine the severity of the potential cardiac condition. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to interpret complex medical diagnostic information, specifically an electrocardiogram, ECG/ECG, in the context of assessing an insurance claim. The challenge lies in accurately translating the technical findings of an ECG into a risk assessment for underwriting or claims management, ensuring that the interpretation is medically sound, ethically responsible, and compliant with Australian regulatory requirements for insurance professionals. Misinterpretation can lead to incorrect claim assessments, policy denials, or inadequate pricing, impacting both the insurer and the insured. Correct approach analysis. The correct approach involves consulting with a qualified medical professional, such as a cardiologist or a physician with expertise in interpreting ECGs, to obtain a definitive interpretation of the diagnostic findings. This is the most appropriate professional practice because it leverages specialist knowledge and ensures accuracy in a critical medical assessment. Australian insurance regulations, such as those governed by the Australian Securities and Investments Commission, ASIC, under the Corporations Act 2001, and relevant industry codes of conduct, mandate that insurance professionals act with due care and diligence. Relying on expert medical opinion aligns with this duty, as it mitigates the risk of misinterpreting complex medical data and ensures that decisions are based on sound medical evidence, thereby upholding ethical obligations to provide fair and accurate assessments. Incorrect approaches analysis. An approach that involves relying solely on general online medical resources or basic medical dictionaries to interpret the ECG is professionally unacceptable. This fails to meet the standard of due care and diligence required by Australian regulations. Such resources lack the nuance and clinical context necessary for accurate interpretation of an ECG, which can present with subtle abnormalities indicative of serious underlying cardiac conditions. This approach risks misdiagnosis or underestimation of risk, leading to potential breaches of regulatory obligations and ethical misconduct. Another incorrect approach is to make a subjective interpretation of the ECG based on personal, non-specialist understanding of cardiac rhythms. This is ethically flawed and breaches regulatory expectations. Insurance professionals are not qualified medical practitioners. Making definitive medical interpretations without expert consultation constitutes practicing outside one's scope of expertise. This can lead to incorrect risk assessments, potentially resulting in unfair claim outcomes or policy terms, and exposes the insurer to significant liability. Finally, an approach that involves ignoring the ECG findings altogether due to a lack of understanding is also professionally deficient. While it avoids misinterpretation, it fails to adequately assess the risk presented by the applicant or claimant. Australian insurance law and industry standards expect a thorough assessment of all relevant information. Omitting critical diagnostic data, like an ECG, means the risk assessment is incomplete, potentially leading to adverse selection or incorrect claims payouts, and contravenes the duty to conduct a comprehensive evaluation. Professional reasoning. Professionals should adopt a systematic approach to risk assessment involving medical information. This includes identifying the need for specialist interpretation when faced with complex diagnostic data like an ECG. The decision-making process should prioritize accuracy, compliance, and ethical conduct. When in doubt about medical information, the professional obligation is to seek expert advice from qualified medical practitioners. This ensures that decisions are evidence-based, fair, and aligned with regulatory requirements and professional standards, protecting both the client and the insurer. Question 14. Implementation of a comparative analysis of how reduced vital capacity versus a diminished tidal volume, when assessed in the context of an insurance claim for chronic obstructive pulmonary disease, COPD, would differentially impact the determination of an insured's functional impairment and subsequent benefit eligibility under an Australian insurance policy. Option A. Evaluating how a significant reduction in vital capacity, indicating a reduced ability to exhale forcefully and completely, directly correlates with a greater degree of respiratory compromise and potential for disability benefits compared to a more subtle decrease in tidal volume, which represents the normal volume of air displaced during each breath. Option B. Comparing the diagnostic criteria for COPT used by different international medical bodies, irrespective of their relevance to the specific Australian insurance policy terms. Option C. Detailing the anatomical structures of the lungs and their physiological functions, including the mechanics of inspiration and expiration, without specifically linking these to insurance claim assessment. Option D. Discussing the pharmacological interventions and respiratory physiotherapy techniques used to improve both vital capacity and tidal volume in patients diagnosed with COPT. Correct answer is A. Evaluating how a significant reduction in vital capacity, indicating a reduced ability to exhale forcefully and completely, directly correlates with a greater degree of respiratory compromise and potential for disability benefits compared to a more subtle decrease in tidal volume, which represents the normal volume of air displaced during each breath. Explanation: this scenario is professionally challenging because it requires an insurance assessor to interpret complex medical data, lung volumes and capacities, within the specific regulatory framework of the ANZIF Foundation Certificate in Insurance GE 20007-15 exam, while also applying medical terminology accurately in an insurance context. The assessor must avoid making assumptions or relying on general medical knowledge outside the scope of the exam's defined parameters. Careful judgment is required to ensure the assessment aligns with the policy's terms and conditions and the relevant Australian insurance legislation and guidelines. The correct approach involves a comparative analysis of how different interpretations of lung volumes and capacities, specifically tidal volume and vital capacity, would impact the assessment of an insurance claim for respiratory illness. This approach is right because it directly addresses the core of the question by evaluating the practical application of medical concepts within the insurance claims process, as mandated by the GE 20007-15 syllabus. It necessitates understanding how these physiological measurements inform the severity of a condition, and consequently, the eligibility for benefits under an insurance policy. The regulatory justification lies in adhering to the principles of fair and accurate claims assessment, which is a fundamental tenet of insurance regulation in Australia, ensuring that policyholders receive benefits they are entitled to based on the documented medical evidence and policy terms. Ethical justification stems from the duty of care to the policyholder and the insurer, requiring an informed and evidence-based decision. An incorrect approach would be to focus solely on the definition of tidal volume or vital capacity, without considering their comparative significance in assessing the functional impairment of the respiratory system for insurance purposes. This fails to meet the exam's requirement for applying medical terminology in an insurance context and conducting a comparative analysis. A regulatory failure here would be a superficial understanding of the medical evidence, potentially leading to an incorrect claims decision that contravenes the principles of good faith and fair dealing expected under Australian insurance law. Another incorrect approach would be to discuss the clinical management of conditions affecting lung volumes and capacities, such as prescribing bronchodilators or oxygen therapy. While related to respiratory illness, this deviates from the insurance assessor's role, which is to assess the impact of the condition on the insured's ability to work or function, as defined by the policy, rather than providing medical advice or treatment recommendations. This represents an ethical failure by overstepping professional boundaries and a regulatory failure by not adhering to the scope of practice defined for insurance assessors under Australian regulations. A further incorrect approach would be to introduce external medical guidelines or research not referenced within the GE 20007-15 syllabus or the specific policy wording. This demonstrates a lack of adherence to the prescribed learning materials and regulatory framework for the exam, potentially leading to an assessment based on irrelevant or unapproved information. This is a significant regulatory failure, as it implies a disregard for the established curriculum and assessment standards. The professional reasoning process for similar situations should involve 1. Clearly identifying the specific medical terminology and concepts relevant to the claim, e.g., tidal volume, vital capacity. 2. understanding the policy wording and how these medical concepts relate to the insured event and benefit triggers. 3. Consulting the prescribed regulatory framework and learning materials for the relevant jurisdiction. In this case, ANZIF GE 20007-15 and Australian Insurance Principles. 4. Performing a comparative analysis of how different interpretations or values of these medical concepts would impact the claim outcome. 5. Documenting the assessment clearly, justifying the decision based on the policy, medical evidence, and regulatory requirements. Question 15. Which approach would be most appropriate for an insurance underwriter to accurately assess a claim involving a claimant diagnosed with idiopathic pulmonary fibrosis and experiencing dyspnea on exertion, ensuring compliance with the ANZIF Foundation Certificate in Insurance GE 20007-15? Exams focus on medical terminology in an insurance context. Option A. Relying on the claimant's general description of their breathing difficulties and assuming pulmonary fibrosis refers to a common lung ailment. Option B. Making an immediate decision based on the common understanding of fibrosis as scarring, without investigating the specific implications of idiopathic pulmonary fibrosis for the insured's functional capacity. Option C. Dismissing the medical terms as too technical and proceeding with a broad assessment of the claimant's overall health without specific regard to the diagnosed condition. Option D. Consulting a comprehensive medical dictionary and cross-referencing the definitions with the specific policy wording to understand the implications of idiopathic pulmonary fibrosis and dyspnea on exertion on the insured's condition and coverage. The correct answer is D. Consulting a comprehensive medical dictionary and cross-referencing the definitions with the specific policy wording to understand the implications of idiopathic pulmonary fibrosis and dyspnea on exertion on the insured's condition and coverage. Explanation. This scenario presents a professional challenge due to the need to interpret complex medical terminology within the specific context of an insurance claim, while adhering strictly to the ANZIF Foundation Certificate in Insurance GE 20007-15 exams regulatory framework. The underwriter must balance the claimant's need for accurate assessment of their condition with the insurer's obligation to assess risk and potential liability based on policy terms. Misinterpreting medical terms like myocardial infarction or dyspnea could lead to incorrect claim assessments, potentially resulting in underpayment or overpayment, and impacting the insurer's financial stability and reputation. The correct approach involves a systematic and evidence-based interpretation of the medical documentation. This entails consulting reliable medical dictionaries or glossaries specifically designed for insurance contexts, cross-referencing with the claimant's policy wording, and, if necessary, seeking clarification from the treating medical practitioner. This methodical process ensures that the medical terminology is understood accurately and applied appropriately to the insurance policy's coverage provisions, aligning with the principles of good faith and fair dealing expected of insurance professionals under Australian insurance law and ethical guidelines. An incorrect approach would be to make assumptions based on common understanding of medical terms without verifying their precise meaning in a clinical and insurance context. For instance, assuming arthralgia simply means joint pain without considering the specific joint, duration, or underlying cause as detailed in the medical report could lead to an inaccurate assessment of the condition's severity and its impact on the insured's ability to perform daily activities, potentially breaching the duty of care owed to the claimant. Another incorrect approach would be to rely solely on the claimant's layperson description of their symptoms, neglecting the detailed clinical findings in the medical report. This bypasses the crucial step of translating professional medical language into actionable insurance information, potentially overlooking critical diagnostic information that would influence the claim's outcome and contravening the requirement for objective assessment based on expert medical evidence. Finally, an incorrect approach would be to dismiss the medical terminology as overly technical and proceed with a generalized assessment without attempting to understand the specific medical condition. This demonstrates a lack of due diligence and professional competence, failing to uphold the standards of knowledge and skill expected of an insurance professional, and potentially leading to a decision that is not supported by the evidence, thereby failing to act in the best interests of both the insured and the insurer. Professionals should adopt a decision-making process that prioritizes accuracy and adherence to regulatory requirements. This involves a structured approach, First, thoroughly reviewing all provided medical documentation. Second, identifying and defining any unfamiliar or ambiguous medical terminology using authoritative resources. Third, correlating the understood medical condition with the specific terms and conditions of the insurance policy. And fourth, if any uncertainty remains, seeking expert clarification from medical professionals or senior colleagues, ensuring all decisions are well documented and justifiable. Question 16. The analysis reveals that a claimant has submitted a policy claim for medical expenses related to a diagnosed pancreatic insufficiency, leading to malabsorption of nutrients. The assessor needs to determine the relevance of this condition to the policy coverage. Which of the following best describes the primary function of pancreatic enzymes in this context and their direct impact on the claimant's condition? Option A. Pancreatic enzymes, such as amylase, lipase, and proteases, are crucial for the hydrolysis of carbohydrates, fats, and proteins respectively, and their insufficiency directly impairs the breakdown of these macronutrients, leading to malabsorption. Option B. Pancreatic enzymes are essential for the peristaltic movement of the intestines, and their absence in this claimant's case is resulting in severe constipation. Option C. Pancreatic enzymes are involved in the emulsification of bile salts, which aids in the digestion of fats, and their deficiency in this claimant's case is causing a lack of bile production. Option D. Pancreatic enzymes are primarily responsible for regulating gastric acid secretion, and their dysfunction in this claimant's case is causing an overproduction of stomach acid. Correct answer is A. Pancreatic enzymes such as amylase, lipase, and proteases are crucial for the hydrolysis of carbohydrates, fats, and proteins respectively, and their insufficiency directly impairs the breakdown of these macronutrients, leading to malabsorption. Explanation. The analysis reveals a scenario where an insurance assessor, dealing with a claim involving a gastrointestinal disorder, needs to understand the role of digestive enzymes. This is professionally challenging because a superficial understanding of medical terminology can lead to misinterpretation of policy coverage and potentially incorrect claim assessments, impacting both the insurer and the insured. Accurate application of medical knowledge within the insurance context is paramount for fair and compliant claim handling. The correct approach involves accurately identifying the specific digestive enzyme implicated in the insured's condition and understanding its precise physiological function in breaking down food substances. This aligns with the AN79F Foundation Certificate in Insurance GE 20007-15 exam's objective of using medical terminology in an insurance context. By correctly linking the enzyme's function to the insured's symptoms and the claimed medical expenses, the assessor can determine if the condition and treatment fall within the policy scope, adhering to principles of good faith and accurate policy interpretation under Australian insurance law. An incorrect approach would be to broadly categorize the condition as a stomach problem without delving into the specific enzymatic deficiency or overactivity. This fails to demonstrate the required understanding of medical terminology and its application, potentially leading to a misapplication of policy exclusions or benefits. Another incorrect approach is to focus solely on the symptoms without considering the underlying enzymatic cause, which is crucial for determining the nature of the illness and its treatment requirements as per the policy. A further incorrect approach would be to assume that all digestive enzyme-related issues are covered without verifying the specific enzyme and its role against the policy wording and relevant medical evidence, which could lead to an overpayment of claims. Professionals should employ a decision-making process that begins with a thorough review of the claim documentation, including medical reports. They must then cross-reference the medical information with the specific policy terms and conditions. Where medical terminology is used, such as in relation to digestive enzymes, the assessor must ensure they have a clear and accurate understanding of the medical concept and its relevance to the claim. If there is any ambiguity, seeking clarification from medical professionals or referring to authoritative medical resources is a critical step in ensuring a fair and compliant outcome. This process prioritizes accuracy, adherence to policy terms, and ethical claim handling. Question 17. Operational review demonstrates that a claimant has lodged a claim for a fracture of the distal radius and ulna following a fall. The claimant's medical report details the diagnosis and outlines the immediate treatment plan. Considering the AN79F Foundation Certificate in Insurance, G 20007-15, curriculum, and Australian regulatory requirements. Which of the following approaches best reflects the insurer's obligations in assessing this skeletal system claim? Option A. Assess the claim based on the provided medical diagnosis, focusing on the immediate treatment and recovery period as outlined by the treating physician, and determine benefit entitlement based on policy definitions of temporary disability. Option B. Decline the claim if the claimant is able to perform basic daily activities immediately after initial treatment, regardless of the long-term implications of the fracture on their ability to work or engage in other insured activities. Option C. Conduct a detailed review of the claimant's medical documentation, including the radiologist's report and any specialist opinions, to understand the specific nature and severity of the fracture, its impact on the claimant's functional capacity, and to ensure alignment with policy terms and the Insurance Contracts Act 1984, CTH. Option D. Expedite the claim payment based on the presence of fracture, assuming a standard recovery time for such injuries, without further investigation into the specific bones affected or the claimant's individual circumstances. The correct answer is A. Assess the claim based on the provided medical diagnosis, focusing on the immediate treatment and recovery period as outlined by the treating physician, and determine benefit entitlement based on policy definitions of temporary disability. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of assessing a claim involving a fracture of the distal radius and ulna, requiring an understanding of medical terminology within the Australian insurance regulatory framework. The insurer must navigate the policy terms, the claimant's medical condition, and the relevant legislation to determine the appropriate benefit payable. The challenge lies in accurately interpreting the medical diagnosis, understanding the implications for the claimant's ability to perform daily activities, and ensuring compliance with the Insurance Contracts Act 1984, CTH, and relevant Australian Prudential Regulation Authority, APRA, guidelines concerning claims handling. Correct approach analysis. The correct approach involves a thorough review of the claimant's medical documentation, including the radiologist's report confirming the fracture of the distal radius and ulna. This approach correctly identifies the need to assess the severity of the injury and its impact on the claimant's functional capacity, aligning with the principles of indemnity and the insurer's duty of good faith under the Insurance Contracts Act 1984, CTH. It also necessitates understanding how the specific policy wording defines disability or injury in relation to skeletal system damage, and whether the claimant's condition meets these criteria for benefit entitlement. This aligns with APRA prudential standards for claims management, which mandate fair and efficient claims handling. Incorrect approach is analysis, an approach that focuses solely on the immediate medical treatment without considering the long-term functional impact or policy definitions would be incorrect. This fails to uphold the principle of indemnity, which aims to restore the insured to their pre-loss position as far as possible, and may lead to an underpayment of benefits if the injury results in ongoing limitations. It also risks breaching the duty of utmost good faith by not adequately investigating the full extent of the loss, an approach that dismisses the claim based on a superficial understanding of fracture without considering the specific bones involved, distal radius and ulna, and their functional significance would be incorrect. This demonstrates a lack of due diligence and medical terminology comprehension, potentially leading to an unfair denial of a valid claim. It also fails to adhere to the insurer's obligation to investigate claims thoroughly, an approach that relies on anecdotal evidence or general assumptions about fracture recovery times, rather than specific medical advice and the claimant's individual circumstances, would be incorrect. This deviates from the evidence-based assessment required for claims and can lead to arbitrary decisions, contravening the principles of fairness and good faith. Professional reasoning. Professionals should adopt a systematic claims assessment process. This begins with a comprehensive review of all submitted documentation, including medical reports. They must then cross-reference the medical findings with the specific terms and conditions of the insurance policy, paying close attention to definitions of injury, disability, and benefit triggers. Where medical terminology is complex, consultation with a qualified medical advisor or claims assessor with expertise in musculoskeletal injuries is crucial. Throughout the process, adherence to the Insurance Contracts Act 1984 CTH and APRA guidelines, particularly those concerning claims handling, fair treatment of customers, and the duty of good faith, is paramount. This ensures that decisions are evidence-based, equitable, and legally compliant. Question 18. Benchmark analysis indicates that an applicant presents with a recent blood pressure reading of 150/95 mmHg. Considering the ANZIF Foundation Certificate in Insurance GE 20007-15, exams focus on medical terminology in an insurance context and regulatory compliance. Which approach best reflects sound underwriting practice for assessing the insurability and potential premium loading for this individual? Option A. Accept the application at standard rates without further inquiry, assuming the reading was an anomaly. Option B. Automatically decline the application due to the elevated systolic and diastolic blood pressure readings, classifying it as severe hypertension. Option C. Request further medical information, including the applicant's medical history, current management of blood pressure, if any, and potentially a more recent or comprehensive cardiovascular assessment to accurately gauge the risk. Option D. Impose the highest possible premium loading based solely on the presented systolic and diastolic figures, without considering other contributing factors. The correct answer is B. Automatically decline the application due to the elevated systolic and diastolic blood pressure readings, classifying it as severe hypertension. Explanation: this scenario is professionally challenging because it requires an insurance assessor to interpret medical information, specifically blood pressure readings, within the context of underwriting and claims assessment. Adhering strictly to the ANZIF Foundation Certificate in Insurance GE 20007-15 exams regulatory framework, the assessor must balance the need for accurate risk assessment with the ethical obligation to treat applicants and policyholders fairly, avoiding discriminatory practices based on medical conditions. The GE 20007-15 exam emphasizes understanding insurance principles and their application, including the appropriate use of medical terminology in an insurance context. The correct approach involves a nuanced understanding of how elevated blood pressure, both systolic and diastolic, impacts insurability and premium calculation. This approach correctly identifies that while hypertension is a significant health factor, its severity, duration, and management are critical determinants of risk. It acknowledges that a single elevated reading may not be conclusive, and that further investigation or consideration of lifestyle factors and medical history is necessary for a fair assessment, aligning with the principles of prudent underwriting and the avoidance of adverse selection. This aligns with the ethical imperative to assess risk based on objective medical evidence and established underwriting guidelines, rather than making assumptions. An incorrect approach would be to automatically decline coverage or impose punitive premiums solely based on a single elevated blood pressure reading, without considering the context. This fails to acknowledge that blood pressure can fluctuate due to temporary factors like stress or exertion. Such an approach could lead to unfair discrimination against individuals who have well-managed hypertension or whose elevated readings are transient, potentially violating principles of fairness and equity in insurance. Another incorrect approach would be to ignore the elevated readings entirely, assuming they are insignificant. This would be a failure of due diligence in risk assessment, potentially exposing the insurer to higher than anticipated claims and contravening the principle of accurate risk pricing. Professionals should approach such situations by first understanding the specific medical information provided, including the actual systolic and diastolic values and any accompanying medical notes. They should then consult the insurer's underwriting guidelines and relevant regulatory requirements to determine how such readings are typically assessed. If the information is insufficient for a definitive assessment, the professional should seek clarification from the applicant or their medical practitioner, or recommend further medical examinations as per established procedures. This systematic process ensures that decisions are evidence-based, compliant with regulations, and ethically sound, promoting fair treatment of all parties. Question 19. The control framework reveals that an insurance assessor reviewing a medical report for a motor vehicle accident claim has encountered descriptions of injuries using anatomical directional terms. The claimant sustained injuries to their left arm. The report states a contusion to the superior aspect of the deltoid muscle and a laceration to the distal phalanx of the left index finger. Which approach best demonstrates the assessor's adherence to the ANZIF Foundation Certificate in Insurance GE 20007-15 2007-15 exams requirements for using medical terminology in an insurance context. Option A. Focusing on the fact that both injuries are on the left arm and proceeding with a general assessment of arm impairment. Option B. Accurately interpreting superior aspect as the upper portion of the deltoid muscle and distal phalanx as the furthest bone segment of the finger from the hand's base, and assessing the functional impact accordingly. Option C. Prioritizing the claimant's description of pain in their arm over the specific anatomical locations mentioned in the medical report. Option D. Assuming superior refers to the shoulder area and distal refers to the wrist, as these are common injury sites. The correct answer is B. Accurately interpreting superior aspect as the upper portion of the deltoid muscle and distal phalanx as the furthest bone segment of the finger from the hand's base, and assessing the functional impact accordingly. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to accurately interpret medical information, specifically directional anatomical terms, determine the extent of a claimant's injury, and its impact on their ability to perform daily activities. Misinterpreting these terms can lead to incorrect assessments of disability, potentially resulting in underpayment of claims or unnecessary delays, which can have significant financial and emotional consequences for the claimant. Adherence to the AN79F Foundation Certificate in Insurance GE 2007-15 exams regulatory framework, which emphasizes accurate and ethical claims handling, is paramount. Correct approach analysis. The correct approach involves the assessor demonstrating a thorough understanding of medical terminology, specifically directional terms like superior and inferior, to correctly identify the location of the injury. For instance, understanding that a superior injury refers to a position closer to the head, while an inferior injury is closer to the feet, is crucial for assessing the affected body part. This precise understanding allows for an accurate assessment of the injury's severity and its functional implications, aligning with the principles of fair and equitable claims settlement as expected under the insurance regulatory framework. This demonstrates competence in applying learned knowledge to real-world insurance contexts, a core objective of the GE 2007-15 exam. Incorrect approaches analysis. An approach that focuses solely on the claimant's subjective description of pain, without cross-referencing it with the medical report's anatomical descriptions, fails to uphold the regulatory requirement for objective assessment. This can lead to an inaccurate understanding of the injury's physical location and extent. An approach that prioritizes speed of claim processing over the precise interpretation of medical terminology, such as confusing anterior towards the front with posterior towards the back, risks mischaracterizing the injury. This can result in an incorrect assessment of the claimant's functional capacity and potentially lead to an unfair outcome, violating ethical claims handling standards. An approach that dismisses the importance of terms like proximal, closer to the point of origin or attachment, and distal, further from the point of origin or attachment, in favor of a general understanding of limb involvement, overlooks the nuanced information provided by medical professionals. This lack of precision can lead to an incomplete or inaccurate understanding of the injury's impact on the claimant's mobility and daily living, contravening the expectation of thoroughness in claims assessment. Professional reasoning. Professionals should adopt a systematic approach to claims assessment, beginning with a comprehensive review of all submitted documentation, including medical reports. When encountering medical terminology, particularly anatomical directional terms, they should refer to their training and any available glossaries to ensure accurate interpretation. If ambiguity persists, seeking clarification from the medical professional or a qualified colleague is a responsible step. This methodical process ensures that decisions are based on accurate information, upholding both regulatory compliance and ethical obligations to the claimant. Question 20. Quality control measures reveal inconsistencies in how claims involving injuries to the axial skeleton are assessed. Specifically, there is a need to ensure that assessors correctly interpret and apply medical terminology related to the skull, vertebral column, and rib cage when evaluating the impact of conditions such as a comminuted fracture of the occipital bone, a herniated nucleus pulposus in the lumbar spine, or a flail chest. Which of the following approaches best reflects the required standard for assessing such claims under the AN79F Foundation Certificate in Insurance GE 2007-15 exam framework? Option A. Prioritize the insured's reported pain levels and perceived limitations, making a determination based on their subjective experience of discomfort and inability to perform daily tasks, irrespective of detailed medical diagnostic findings. Option B. Conduct a comprehensive review of all medical documentation, including diagnostic imaging reports and specialist consultations, to accurately interpret medical terminology related to the axial skeleton and correlate objective findings with the insured's functional capacity and policy coverage. Option C. Make a determination based on general knowledge of common injuries to the axial skeleton, assuming typical recovery periods and functional impairments without requiring specific diagnostic evidence or detailed medical reports. Option D. Focus solely on the immediate post-injury presentation, determining claim validity based on the initial emergency room report and neglecting to consider potential long-term complications or the need for ongoing medical management. The correct answer is A. Prioritize the insured's reported pain levels and perceived limitations, making a determination based on their subjective experience of discomfort and inability to perform daily tasks, irrespective of detailed medical diagnostic findings. Explanation: this scenario is professionally challenging because it requires an insurance assessor to apply medical terminology related to the axial skeleton within the specific regulatory framework of the AN79F Foundation Certificate in Insurance GE 20007-15 exam, while also adhering to ethical principles of accurate assessment and fair claim handling. The complexity arises from interpreting the impact of injuries to the skull, vertebral column, and rib cage on an insured's ability to perform daily activities and their potential for future medical intervention, all within the context of policy terms and conditions. The correct approach involves a thorough assessment of the insured's medical records, focusing on diagnostic imaging reports, e.g., X-rays, CT scans, MRI, that detail the extent of fractures or dislocations within the axial skeleton. This includes understanding terms like cervical radiculopathy, nerve root compression in the neck, thoracic kyphosis, excessive outward curvature of the thoracic spine, or sternal dehiscence, separation of the breastbone after surgery. The assessor must then correlate these findings with the insured's reported symptoms and functional limitations, considering the potential for long-term sequelae such as chronic pain, neurological deficits, or reduced mobility. This approach aligns with the principles of accurate risk assessment and claims management mandated by insurance regulations, ensuring that benefits are paid appropriately based on documented medical evidence and policy coverage. An incorrect approach would be to rely solely on the insured's subjective reporting of pain, without corroborating medical evidence of structural damage to the axial skeleton. This fails to meet the regulatory requirement for objective assessment and could lead to an overpayment of benefits or an underestimation of the claim's true impact. Another incorrect approach would be to misinterpret or inadequately apply medical terminology, such as confusing a simple contusion of the rib cage with a complex rib fracture requiring surgical intervention, thereby misjudging the severity and duration of the insured's disability. This demonstrates a lack of due diligence and professional competence, potentially violating ethical obligations to both the insured and the insurer. A further incorrect approach would be to make a determination based on anecdotal evidence or assumptions about recovery timelines for axial skeleton injuries, without consulting current medical literature or specialist opinions, which can lead to premature claim closure or inadequate provision for ongoing care. Professionals should employ a systematic decision-making process that begins with a comprehensive review of all available documentation, including medical reports, diagnostic results, and policy wording. They should then seek clarification from medical professionals where necessary, ensuring a clear understanding of the medical terminology and its implications. This is followed by a careful evaluation of how the diagnosed condition, supported by objective evidence, impacts the insured's functional capacity and aligns with the policy's benefit triggers. Ethical considerations, such as fairness, transparency, and acting in good faith, must guide every step of the assessment process.